one is really looking forward to the opportunity to be able to talk to you. So I'm not going to talk anymore. I'm just going to say welcome to Tony. Thank you, and over to you.
Okay, would you like me to go through the questions, Tony? And
yeah, if you could, that
yeah,
would be great.
okay. So the first one was, is there anything more to help with back pain?
Fine. Well, I think obviously the problem we're trying to work out how to deal with back pain is trying to find out what the cause is, because obviously that can influence what the problem is, and therefore what the best treatment is. Obviously, as we know, that people with PWS are more likely to have a high pain threshold and therefore don't often experience pain when others might. And so obviously if they are experiencing pain, the worry might be that is there something more going on than just nothing too serious. So I think it's important for a diagnosis to be made. Obviously, when people are overweight, they are more at risk of getting wear and tear in the joints and getting arthritis, and therefore that needs to be excluded. And there might also be a possibility of a problem with the disc. So I think it really needs assessment. I mean, sometimes people have injections, local anesthetic injections, if there is a problem with the back that is responsive to that. So I think it's difficult to say, what the best treatment is until a diagnosis is achieved. And so I think it really needs an assessment to work out what the diagnosis is. And then there might be something other than simple painkillers to treat it, such as I said, sometimes injections are used as well, because there can be some inflammation causing back pain as well.
Okay, thank you. The next one is, what do you think that it is important for other healthcare professionals or carers that I come into contact with to know about my condition?
So I think part of the issue is that a lot of healthcare professionals and carers may not know much about Prader-Willi syndrome, and so there is quite a lot of general education that needs to be done. There are certain parts of the syndrome that I think healthcare professionals need to know, and I think in the emergency setting, and if someone is very unwell and going to an emergency department, I think it's very important that the doctors there, who again may not know about Prader-Willi, understand that people with PWS may not present in a usual way if they have problems such as problems with their intestines or infections, that they may not have a high temperature, they may not experience pain, they may not feel nauseated and vomit. And that can be a particularly serious problem if people have a problem with their bowels, and in rare cases, you can get infection in the bowels or perforations in the bowel, related to Prader-Willi or not related to Prader-Willi. And the doctors in the accident department may not appreciate that and go, oh, put a hand on people's tummy and go, everything's fine, you can go. But actually, if they vomited or they're experiencing pain, that needs to be taken seriously, because people with PWS don't usually experience marked pain or vomit. And so if they are getting that, it could be a sign of something more severe going on than they might otherwise think. And so I think that's very important. Obviously, another issue when sometimes people are admitted into hospital with something, an infection or something like that, that obviously sometimes the ward and the ward staff may not be aware about the fact that they need to be very careful about food being left out, and the kitchen on the ward being unlocked, and other patients on the ward who have food lying around. People bring in food, and obviously that is a temptation for people with PWS. And so the ward being aware that they need to keep that stuff out of sight and locked away, because otherwise it's a temptation, which is unfair on the person with PWS. So those, I think, are the most important things.
Okay. Thank you. The next one is, what health complications do we need to know about as we age?
So I think it's fair to say that we don't know an awful lot at the moment about people with PWS having more problems as they age. It's only in recent years, as care has got better, that there have been a lot more people around in the older years, and so we haven't got a lot of data yet to know if there are any particular things that people with PWS might be more likely to get as they get older. Obviously, our concerns are if people do have problems with their weight or have diabetes, then obviously that puts them at increased risk of problems with the heart. And so we worry about the risk of heart failure or heart people older. We haven't seen a lot of that yet, certainly in my patients. But obviously, the weight and diabetes are risk factors for that as people age, and so we need to watch for that. So if people are getting more short of breath or getting chest pains when they walk or things like that, that's something that we need to take seriously and do the appropriate investigations to make sure that their heart is all right. I do reasonably regular blood tests to look at the heart, and also scans of the heart every few years, just to keep an eye on the functioning of the heart. We don't know if there is a risk that people with Prader-Willi syndrome may be more prone to having problems with their memory and their cognition, their things as they get older, and whether there is an increased risk that obviously as people get older, memory isn't as good, and as in the general population, as people get into their 80s and beyond, there's increased risk of dementia, particularly Alzheimer's dementia. We don't know yet whether there is any increased risk of people with Prader-Willi getting problems with their memory and early dementia. We just don't have any data on that, and that's something that we hope to gather that more information in the future. But certainly, if people are noticing that they're not as sharp, their memory is not as good as they get older, that's something that we may need to look into get investigations of.
Okay, thank you for that one. The next one is, what causes pain in Prader-Willi syndrome, and what's your best knowledge and understanding about adults and younger children with Prader-Willi syndrome? That's a very open question.
Yes, I'm not sure if that needs to be a little bit difficult. So in pain, what causes pain in PWS is exactly the same things that cause pain in anybody. But we know that people with Prader-Willi will likely experience less pain than someone who doesn't have Prader-Willi, and we think that's because the genes that are missing in Prader-Willi mean that some of the pain pathways in the body are not functioning normally, and so they don't detect the pain to the same degree. The second question, I'm not really sure where to start there because it's a rather broad question.
It's very broad, yeah.
So I don't quite know where to start there, I have to be honest.
Okay, let's move on and have a look at the next one, which is there any diabetic medicine or insulin that doesn't cause weight gain?
Yes. So one has to always firstly say that one of the reasons why people may gain weight when they go on to diabetes medicine is that you have to remember that when diabetes sugar control is not very good and the sugar levels are high, what happens is the sugar levels spill over into the urine when you go to the toilet and pee, and you basically pee out sugar, and that's quite a lot of calories. So when one gets the sugar control better, you're no longer peeing out the calories, so you're keeping the calories on board, and so that is a contribution to weight gain. Whereas when the sugar control was not very good, some of those calories just went down into the toilet. So that's one of the reasons why sometimes any medicine that improves the sugar may be at risk of weight gain. Certainly insulin does produce weight gain, but there are newer medications that are less likely to do that. Metformin, which is probably the first line medicine that we use for diabetes these days, especially if people are overweight, doesn't generally cause weight gain, and in fact may cause a little bit of weight loss, and that's very commonly used. There is injections of medicines around a hormone called GLP-1, and that's a hormone that regulates our insulin levels, but it also reduces appetite. There's not a lot of evidence that it's particularly effective for weight loss, although some people may get some weight loss, but it doesn't seem to cause weight gain. People with Prader-Willi may be less responsive to it as a medicine, but that's a medicine. There are various versions of the medicine: exenatide, liraglutide, dulaglutide, and they're given as either daily or once weekly medications. And in people without Prader-Willi, they it depends what the dose is, but they can cause 6 or 7 kilograms of weight loss, maybe on average, or maybe closer to 5. There is a newer medicine called semaglutide, which seems to be more effective for weight loss in people without Prader-Willi, possibly causing 3 to 4 times as much weight loss, but is yet that I'm aware of to any great extent in people with PWS. The fact that liraglutide and exenatide don't produce much weight loss does make us worry that semaglutide might not cause as much weight loss, but it's possible it may be able to cause some because it's generally more effective, and it's thought that it maybe gets into the brain to act a little bit better. So it'll be interesting to see when that medicine is used in people with PWS, whether it is any better. There's also another new type of medicines called SGLT2 inhibitors, and what they do actually is they help the kidney get rid of the glucose in the urine, like I talked about before, and help lower the blood glucose level. And in people without Prader-Willi, they are also beneficial in causing some weight loss. Certainly that weight loss may be there, but at least they don't cause weight gain. There are some concerns about that medicine. I've found in a few of the people I've treated that they can increase the risk of getting urine infections and thrush infections down below. So one does have to be a little bit cautious, but those are the other medicines. And also the good thing about those medicines is that they don't cause a low blood sugar. One of the problems with insulin as well sometimes is that in some people it can cause low blood sugars, and obviously then you have to overeat to get the sugar back up, and so obviously that's a problem when you're trying to lose weight. So I always try and avoid insulin as much as possible.
That's really interesting about the urine and that you let go of the sugar. I didn't know that. That is really, really interesting. So the calories come out in the urine.
Yeah. So when people many years ago when we used to test people for diabetes, we didn't have these fancy blood glucose machines. We collect urine and put tablets in the urine and look at the change in the color of the urine to detect the glucose in the urine. So that's how we used to detect it and monitor treatment many years ago. It's not perfect because everybody has a slight variation in the blood glucose level at which the glucose spills over into the urine. But that's why when people have uncontrolled sugar levels, they feel thirsty and pass a lot of water, because the sugar is dragging the water with it out into the urine. So you pee more because there's more glucose, and then because you're peeing a lot, you get more thirsty. And that's why when people often, when they're first diagnosed with diabetes, can be quite unwell because they can be very dehydrated because they've been peeing out loads of water and they've got very dehydrated because the sugar has been dragging the water out. So
that's really, really interesting. And that's really helped my own knowledge of that. Thank you very much.
Yeah.
Thank you. The last question is, it's the last question on my sheet, but I think some questions may have come up on the chat box. Is there any science investigations going on as to whether in the future females could get pregnant?
I'm not aware of any active things, particularly in Prader-Willi syndrome. There have been a few cases of women with Prader-Willi syndrome who have got pregnant on their own. There's a handful of cases. That's always quite difficult because there is an increased risk of a child having a different developmental problem called Angelman syndrome. And if they have a deletion as the cause of their Prader-Willi, which is about 3/4 of Prader-Willi, there is half of the children would be at risk of that, and that can cause problems in the child. So that's obviously a concern. And obviously, the question is, obviously it's very variable between different people with Prader-Willi, but obviously looking after a child and raising a child involves an awful lot of care. And so one would need to be very sure that the person with Prader-Willi would be able to manage looking after a child with Prader-Willi, and that obviously has to be done on an individual basis. But there is although there may be a real desire to have a child, the question is it appropriate in terms of what someone with Prader-Willi can do in terms of bringing up a child and looking after a child, and we'll have to look at that. And so to be going down the route of doing the various hormonal manipulations that you would need to do in order to enable someone to get pregnant would be quite difficult to do, because one would need very sure assessments that it's possible for that person to manage looking after a child with Prader-Willi.
Okay, thank you for that.